So this is one of our operating rooms. It's called an angio suite. TOH is equipped with 3 angio suites. And this is one of the rooms where we treat hundreds of patients for cerebrovascular diseases every year. Approximately 90,000 patients suffer from a stroke each year in Canada. And approximately 20% of those patients are having a stroke because of a big clot that formed somewhere in their body and ended up occluding one of the vessels of the brain. And the brain is an organ which, like any other organ, needs blood to survive and function normally. So when patients have a stroke because of a big clot, there is a major flow arrest in a critical and vast area of the brain that is immediately starting to cause irreversible damage to the brain. From that moment, every minute matters, and we need to re-establish blood flow and remove that clot from the brain as fast as possible. And what we'll do is we'll access the artery from the groin. The patient's leg is typically here, and we'll navigate from the groin, our catheters, all the way up inside the patient's body up to the head. This part here replicates the vessels of the leg. This here is the aorta, which is typically in the abdomen and the thorax. Those are the vessels of the neck, and here is the brain. By using this 3D silicone model, we can completely replicate a human procedure from A to Z and test any new devices or procedures that we would like to test. So this is exactly what happens when we're actually treating a patient with a stroke. What you see here is what I can see with my machine. So those are the vessels of a human brain. When it's a real patient, we actually see those vessels because with the X-ray technology, we can see through the skull. So we don't see the patient's head, we just see the patient's vessels. And what you can see here is that I have the tip of my catheter that is going to move on the screen right there. You see it at the bottom left corner. And I'm going to try to navigate that catheter all the way up where there is a clot to try to remove it. Right now, this would be where the brain is. I'm actually exactly at the level of the brain, and I'm navigating my catheter. As you can see, I'm slowly pulling the catheter under aspiration to make sure it captures the clot with it. And then I pull the clot out. The clot is now outside of the brain and the blood flow is restored. If we did this fast enough, patient will hopefully make a fantastic recovery. This is a simulation of a thrombectomy.